Perhaps the most important female fertility factor is the egg factor. By the time a woman starts menstruating, about age 13, she has 500,000 egg follicles left in her ovaries. Now, an egg follicle is a sac that holds one egg. Every month, she's going to release a batch of these egg follicles. Only one of those egg follicles will ultimately grow each month and ovulate, and the rest will die. But every month, women lose eggs, and with time, they run out of eggs, and that's called menopause. By the time a woman's 30, she loses 90% of her eggs. And by the time she's 40, she loses 97%. One thing we test for is called ovarian reserve. That is, how many eggs are left. And unfortunately, patients and some doctors don't really know what this means. So ovarian reserve is used by fertility doctors to determine if a woman has a low ovarian reserve, because those patients make less eggs. Therefore, they have a lower chance of pregnancy with fertility treatment. Ovarian reserve can be tested in a variety of ways. The best way is to perform an ultrasound when that woman's on her period and count the resting egg follicles in the ovaries. Other tests for ovarian reserve include blood tests for the hormone anti-Mullerian hormone, or AMH, and follicle-stimulating hormone, that's FSH, and estradiol. But overall, the key message for ovarian reserve is it's needed by fertility doctors to counsel women on the chance of success with fertility treatment. What's really important is called egg quality. That's different than ovarian reserve. Egg quality basically means the following: the ability of an egg to create a chromosomally normal embryo. Poor eggs create embryos with abnormal chromosomal makeup, and good eggs create embryos with normal chromosomal makeup. Egg quality impacts the chance of a healthy baby, and it's very much age dependent. So women who are in their 40s especially have the lowest egg quality, and actually by the age of 45, it's very rare to find any quality eggs, and pregnancy rates essentially go to zero. The first recommendation I have to couples trying to conceive is to have sex at the right time of the month. The egg only lives one day, so having intercourse for the 1 or 2 days before ovulation and the day of ovulation is critical for conception. To help women determine when they're ovulating, we use ovulation detection kits. So when we see women who don't have regular menstrual cycles, it means they're not ovulating. And reasons for not ovulating could be things such as thyroid problems, excess production of a hormone called prolactin, a medical condition called polycystic ovarian syndrome, or just stress, weight changes, a lot of travel. We can obtain blood to test for some of these hormones, and of course do an ultrasound to look at the ovaries for polycystic ovarian syndrome. So these are simple tests that should be done on women who are not having monthly periods. Sexually transmitted diseases such as chlamydia and gonorrhea, but not HPV or herpes, can lead to fallopian tube damage, and that could be a very significant form of infertility that requires in vitro fertilization or surgery to fix. There's some other conditions that cause fallopian tube blockage, such as pelvic surgery and also endometriosis. Fallopian tube openness or patency can be determined by a test in which we push dye through the uterus and fallopian tubes and take X-ray pictures. One of the most devastating conditions we see is recurrent pregnancy loss. That's where women are able to conceive and carry the pregnancy until 8 or 10 weeks and then lose the pregnancy over and over again. One of the reasons for recurrent pregnancy loss is uterine cavity abnormalities such as fibroids, muscle tumors, polyps, which are little growths, scar tissue, or birth defects that woman was born with in her uterus. Fortunately, we can treat a lot of those uterine factors as it relates to recurrent pregnancy loss using surgical modalities. One of the most frustrating diagnoses that we give to patients is something called unexplained infertility. This is a diagnosis that is assigned when the semen analysis is normal for the male partner, a woman is ovulating, her uterus and tubes are normal, she's of an age that should have quality eggs, but yet they're unable to conceive. Oftentimes, couples with unexplained infertility have to consider in vitro fertilization, which takes over each of nature's steps and tries to fix them and augment the chance of success. So couples who fail to get pregnant sometimes think that they're allergic to each other. There's a mismatch. We don't believe that actually exists, and the reason for that is When we do in vitro fertilization and put the sperm into the egg, we get embryos, and in many cases we get pregnancies.